to hear if there are particular problems either with the course or with any students, and that occurs in the debrief session, as Fraser mentioned. But we also have some technology we use where the tutors are able to give feedback to the students and then inform us if anything needs to be taken any further.
With such a reliance on sort of external support, if you like, we go to great efforts at the start of each semester and even during some of the semesters to have educational meetings to bring them up to speed, just to make sure they sort of using the best and the latest sort of educational approaches, but also to make sure they're well aware of the curriculum, both for what they'll be teaching in terms of tutors over the coming weeks, but also the bigger, broader curriculum, just to make sure they try and integrate the students' learning from other aspects of their curriculum as well. So that's I think a really key part of this, as well as just weekly emails and updates, and we tend to meet after tutorial groups and get formal and informal feedback from the tutors about how things are running as well.
One other thing that I think is really crucial in our medical school, we run, as we said, small group tutorials, and a lot of the content is covered in what we call problem-based learning classes. And I think it's fair to say that the sessional staff who come in and also the Curtin staff who are tutors in those classes have found the process, the model, to be incredibly engaging, and they all are enjoying teaching in that particular format, and they're enjoying the increased engagement with the students. So the idea behind problem-based learning is that the tutors don't go in and pass on information to students. Rather, it's all about student learning and engagement. So the students working in small groups are presented with a problem that they need to work their way through, and it's really a simulation of a clinical case they may well get when they leave university. And the problems really back up and support the clinical skills process that Fraser's been doing in his clinical skills tutorials. And the students work through and identify that there are real gaps in their knowledge, that there are things they just don't know when they're going through these problems, these scenarios. And they identify what those gaps are, and then they go away and research them themselves, and then they come back the following week. And armed with the knowledge, they tackle the scenario again. And the tutor is a clinician, and the tutor can add some information in the end, can identify if they're going off track or perhaps presenting incorrect information. But the process is about the students learning, and all of the responsibility lies with the students. And I think it's fair to say that our tutors have found this process really engaging, and it's great to see the students develop as the year progresses.
The other really important aspect is standardising for assessment as well, and that's certainly in medical education, medical assessment in particular has changed a lot in the last 10 or 15 years, and so we've had external experts come in and sort of guide us as to how the structure of the assessment should be, but therefore we have to then pass that on to our tutors and external examiners and otherwise, and ensure that there's standardisation across everyone, which is it's a great challenge. It's really important. It's a critical part of the process as well. So that's another big part of our week, or certainly at the moment as we move forward to assessment time anyway.
I think it's tough for our sessional staff. Many of the staff come from clinical practice, and they race in here so that they can do their teaching, and then race off again. So they're very time poor, but they're here because they want to be here, and they have approached us to be involved in teaching, which I always think is a good sign, because we do recognise it is tough for those who are working in industry and need to come in here. But I think really importantly, the The informal learning that occurs in the corridor occurs in this really wonderful building where the students hang out, and we can walk up and down the stairs and walk along the different floors and bump into them and have chats with them. We can talk to them about their curriculum, or we can talk to them about something they might have done on the weekend. And there's a wonderful opportunity just to engage with them on a personal level where they know we're interested and they can come and talk to us about anything at any time, and they do. And I think that that will lay the foundation for a really good way forward for the next 5 years. That will allow us to work with the students, not for them.